Good evening. Hello? Just wonder if it was still working. I'm going to tell you that drugs are bad and you shouldn't do them. Any questions? All right. So that strategy has not been terribly successful, at least when put that way. So I have the opportunity and the privilege to actually be able to talk to you because I think that this is how drug problems are going to get better. If you think that drug problems are a medical issue, you're wrong. Or if you think they're a legal issue, you're wrong. They're a community issue. And I know that, having worked in this field 25 years now, that what we do, for example, in our treatment center is a small piece of what it takes to get people better. And the better informed you have families and communities and the better structures you have to deal with this, I think the better outcomes will likely ensue. So I'm going to talk a little bit about some of what the problem is. That drug abuse is a national health concern, no surprise. That the new user of prescription drugs is now equivalent to marijuana use. In fact, now only second to marijuana use is the biggest drug of abuse. Let's see, wait a second here. And believe it or not, I know this might be hard to believe, that teens underestimate the danger of them. See, if we have a prescription drug coming out on the market, it has to go through what? The FDA to prove that it's safe. A street drug is usually considered innocuous until proven otherwise. So about 1 out of 5 teens has misused a drug. Now, during this talk, I'm going to be talking about addiction, but I want you to understand that when I'm talking about addiction, it is a small piece of this puzzle. It's a small piece of the drug problem. And I'm going to talk a little bit about abuse as well. That 1 out of 3 teens report nothing wrong with using prescription drugs. And every day about 2,500 youths misused a prescription drug, for the first time. Prescription drugs are drugs of choice for ages 12 and 13-year-olds, and girls are more likely to use prescription drugs. 9.3% of 12th graders have used Vicodin without a prescription in the last year. 5% of 12th graders have used OxyContin in the last year. I want to tell you something. Now, OxyContin formulation has been changed, but sort of a typical street dose of OxyContin was 80 milligrams. Now, if we were using OxyContin for pain relief, we would use probably not the long-acting form. We would use like 5 milligrams if somebody needed pain relief. So imagine the new person trying an 80 milligram tablet and trying to use it in a form not appropriate, like chewing it up, squishing it up. 5 times 16 is 80. That's 16 tablets of Percocet. It's enough to kill somebody who's not used to it. And most of them get it easily and for free. And guess where? Right? Prescriptions. And most of those prescriptions came from a single doctor. Those are sort of some of the stats of increased drug use. So drug use is not going down. It's increasing. We now have prescription drugs easily available. It's interesting, prescription drugs are often picked now, sometimes again before marijuana is, sometimes before alcohol is. Typical drugs that might have been abused when I was growing up. So I'm going to talk about the brain today. So for the next 2.5 hours, I'm going to talk about the complex neurochemistry of the brain. Okay. So I'll talk about the brain. All right. These guys are already going, Why'd I sit in the front? It'd be harder to get out of here. Okay. And again, I'm going to talk about a group of people who are addicted to the drugs. And it's a significant percentage of people, but then there's this large percentage of people who are misusing and abusing drugs. And some of those will go on to this problem that I'm going to talk about today. So this is your brain. Okay? When I said this is your brain, did anybody think this is your brain on drugs? A fried egg? See, that's kind of the amazing thing about how our brain works. It associates things. It connects things. If I told you don't think of that, you'd still think of it. Some people are going, what's he talking about? It was a commercial, right? It was an old commercial that said, this is your brain on drugs, a fried egg. So it was supposed to be a visual thing. Now, if we look at the brain, and we look at various structures in the brain, and we look at this area of the brain in here, this is a central part of the brain that has a lot to do with drug use. This is an area of the brain that as the brain is forming, we start off with about a trillion nerve cells. And those trillion nerve cells begin to kind of curve around and form sort of this inner rim. Another name for the rim is the limbic system. Sometimes on our campus, this area of the brain is affectionately called the lizard brain. And why it's referred to as that is because some animals, some things like reptiles, have basically that inner structure of brain. Now I'm going to talk a little bit about how that works. That's sort of our survival brain. That's a part of the brain that is protective for us. It's instinctual. It has some basic functions in order for all of us to, say, survive. These are things like the acquisition of food and fluids. Most of them begin with an F. And so if you're hungry, this is the part of the brain that's kind of telling you you're hungry. It has to do with that part of the brain that often looks for security and something soothing and comforting, sort of protective. It's instinctual. So the emotional area of the brain, areas that have to do with emotions are in this area of the brain. Something called fight or flight. Some of you might have experienced this. This is when you're driving home late one night and you look in your rearview mirror and right on your bumper is a blue and red flashing light. You know that feeling? That's the holy cow feeling, all right? Or it's like when somebody cuts you off in traffic and you roll down your window and you go, excuse me, sir, it makes me angry when you cut me off like that, okay? So that's the part of our brain that kicks in, all right? Instinctual, reactive, it's protective. I don't know if it was designed to run away from dinosaurs or not. I know somebody's thinking dinosaurs and man didn't exist at the same time. Who cares? And sex, whoops, flirting, okay. They told me it'd be a higher class audience this time. Okay. So those are basic instinctual things from this survival area of the brain. Now, why is that significant? Well, because this is what science has taught us. In the last 20-some years, scanning techniques, like I showed you here, this is something called a PET scan. It's a view looking down on the top of somebody's head. A PET scan are what's called functional scans. This technology has really helped to elucidate a lot of how our brain works, particularly in regards to drugs. This is a person, not necessarily somebody addicted, who's been given an injection of cocaine. And what you're seeing is areas of the brain becoming more active. That's what the yellow means. And what I want you to think about is what that really represents. It's sort of like if you looked at the muscle in your leg, and you looked at that muscle when it was at a state of rest, and then going to a state of walking very briskly. What would that muscle need? It would need more blood flow to it. It would need more oxygen. And it would need more nutrition or energy in the form of something like sugar. Well, that's what our functional scanning devices tell us about the brain. You don't normally think about that about the brain, but see, the brain is always on. It's an organ, and if a certain area of the brain is more active, it's going to require more blood flow, more oxygen, and more nutrition. This happens to be a PET scan, so it's measuring, in this case, sugar uptake, glucose, which is energy. So what science has shown us that, in fact, if you give a human being basically any of the drugs of abuse, whether it's alcohol, heroin, marijuana, nicotine, any of those drugs, amphetamines, tranquilizers, sedatives, it'll stimulate that area of the brain. Now, this area of the brain here is very much a part of what we'll call the reward area of the brain. Everybody's brain has this. Old studies, when they were looking at structures in the brain, they would take an electrode with an electrical stimulus and trigger various areas of the brain while people were awake. Now, it sounds bad and can't be good, but it was people who had surgery for various tumors. And the interesting thing about the brain, although we perceive pain there, it has no pain fibers itself. So you could actually put these electrodes in your brain and stimulate various areas. In one area you might stimulate, your arm might move. Another area you might feel a pinprick somewhere. But if you stimulate this area of the brain, the nucleus accumbens in a human being, it is the best feeling you've ever had in your entire life. You cannot believe how good this feels. It's really amazing. So I'm told. Okay. So now, if you also stimulate this ventral tegmental area, it also feels good. So I cleverly call this the oh wow area of the brain. And one of the things that we notice here is that all of the drugs of abuse operate somewhere in this area. There are a few exceptions, but the majority of the drugs being abused operate in this oh wow area of the brain. Okay. So, why do people use drugs? What is the deep psychological reason why people use drugs? Is it that simple? Yes. Because I've polled thousands of people over the years, and I've asked them why they're using drugs. And I have yet to have somebody, I like to pass out, puke, and get arrested. That has not been the driving force. That might be what happened to them, but that has not been the driving force. That the driving force to misuse of drugs is people like what it does to them. It has an effect, a positive effect. That positive effect is different for different people. Some people will describe, wow, I love it. I love the energy. I love the high. But there's a large percentage of people, and it also depends on what drug they're using, will just say, I feel better. I feel less bored. I feel more relaxed. I feel more comfortable. I'm less afraid. I'm less shy. It does something positive for them. I think this is important to remember because when you're talking to people like your children, that you acknowledge that there's something they like about it. It's not that they're crazy. There's something they're getting out of it. And that, I think, engenders a little bit of some sensitivity or empathy to this as an issue when you acknowledge, I know there's something you like about it, tell me what it is. Lots of research has been done. They've been identified various things. This is just a really busy slide. Oops. And so a lot of research has been done on trying to delineate what it is that addiction is. We have functional scanning techniques. We have genetic studies that have been done. They've been able to develop animal models. You know you can raise rats that like alcohol. How do you raise a rat that would prefer drinking alcohol? Well, you get a gazillion rats. And you hang up a bottle of water, and you hang up a bottle of water with a little bit of alcohol in it. And you watch the rats who go a little bit to the other side, to the bar every now and then. Then you take that group of rats and you breed them and you take their progeny and you do the experiment again. And you keep doing that, and there are actually several strains of rats, believe it or not, that prefer drinking alcohol rather than water. What does that suggest? Suggest something about how the genetics might play a role. The genes and something predisposing to somebody, the like of the drug or the desire for the drug is there. So, what movie is that from? Young Frankenstein, right? Abnormal Brain. Marty Feldman. See, this is what science has told us. All of those studies that have been gone through in detail have shown a couple of things about addiction. That addiction is, the chemistry in somebody with addiction is fundamentally different. See, if I were to ask doctors, I know I got a few doctors in the audience tonight, what a disease was, they would say, well, it's often abnormal physiologic function that results in certain signs and symptoms. So this is what science has said, that when they examined and studied human addicted people, what they have found that there is an alteration in the brain. There's an alteration in the brain chemistry in terms of its gene expression, in terms of brain metabolism, and something called responsiveness to environmental cues. There's something different that's occurred in the brain, and that meets what we would call the muster of it being a disease. So in understanding addiction as a disease, what we know about addiction is that it's a primary illness. It is not because somebody is depressed. It's not because they're anxious. It's not because they have a history of trauma. If they have addiction, it is a primary illness independent of those issues. That just treating somebody's depression or anxiety cannot be expected to alter the changes in the brain to improve them. Okay? So that at the same time, I'm going to tell you that there's a large percentage of our people who do suffer from addiction who also have depressive illnesses and anxious illnesses and have been traumatized in various ways. So addiction is this. It is a malfunctioning between an area of the brain called the prefrontal cortex. Okay? The prefrontal cortex is an area of the brain that is our wise human brain. Okay? If you remember the slide of the reward area, The reward area sits sort of like if you put your fingers right in front of your ears, it's sort of about that area where it's crossing. I know I got a neurologist in here, and he might be saying, you're off, but too bad. Anyway, it's roughly there, the pleasure area of the brain. Now, if we operated just on our pleasure area all the time, or our reward area, we'd get into trouble. For example, anybody hungry in here right now? Few people. Now, you're sitting here, though. And you're sitting here because your prefrontal cortex is telling you to sit there. And the prefrontal cortex is this wise judgment area of the human brain. This prefrontal cortex does things like, the doctor, he might not have a lot of self-esteem up there. So I don't want to embarrass him by getting up and getting something to eat right now. Okay? Prefrontal cortex might be going, he might have something good to say. Doubtful, but he might. So prefrontal cortex says, I can wait. I don't have to eat right now. Or the prefrontal cortex might be going, I don't have good self-esteem. I'm not getting up in front of everybody and going getting food. Nobody else is eating right now. Okay? So that's sort of how our prefrontal cortex works. Some of you might look across the room and go, wow, that is really nice looking over there. You might have been in a crowd and you've done it. Whoa, that is really, really nice over there. Holy cow. And your prefrontal cortex goes, you better sit there because your wife will get upset. Okay. So your prefrontal cortex regulates the reward area. That's how it's supposed to work. Okay, in a regulated reward area. If you're a reptile like a lizard, now lizards don't have a big prefrontal cortex. That's why I don't like the term lizard brain a whole lot. It says if you were a lizard and you saw the sexiest little lizard walk by you right now, no matter how good my lecture was, you guys would be doing it right there. Okay. Why? Because they don't have that. Just say no air of the brain. So, what we are looking for when we're trying to make a diagnosis of addiction, not drug abuse, addiction, we are looking for loss of control. That is, the prefrontal cortex has lost its ability to say no. Not all the time, sort of unpredictably, that there's these periods of loss of control. I'm just going to go smoke a joint with my friends and I'll be home. Okay, I smoked a joint and had a six-pack and now I'm home. Okay? Is that loss of control or was that willful? Well, sometimes we have to get a good history to make that determination. It's really hard. And, parents, you're not trained to do that. So there's this kind of fuzzy line of where somebody becomes so-called addicted from this, say, use of a drug that sometimes requires the assistance of some helpers. One of the evidences of this, if they continue to do it and bad things keep happening to them, that's one of the signs we look for. And it really doesn't make any difference usually how much or how often somebody's using. We don't use that as a criteria to make a determination whether somebody's an addict or an alcoholic. I mean, if you're drinking a fifth of vodka every day for the last month, you've got a good chance you're an alcoholic. But now, there is this group of people, it's a very large group, who misuse drugs. These are called drug abusers. This is a willful problem. This is not the disease that I usually treat. This is willful and bad judgment, or maybe peer pressure, or maybe somebody's drinking or drugging in times of celebration. They're happy they drink, they're sad they drink, who cares, I drink. They have normal brain chemistry. There's no loss of control. They may stop, but they're going to need some interventions in order to stop. They're going to need your help with that if you address the consequences. Because I put here that they're likely to stop as consequences progress, presuming that something is done. And to compare this to what addiction is, addiction's the disease part of this. Addiction, there is abnormal brain chemistry. They have loss of control, and they're going to probably require some real experts to help out on when they get that bad. If we look at the abuser sort of by graph, what you see is that when somebody uses a drug, why do they use a drug? Okay, got it. So, and if they like it, they might keep doing it, then they might keep doing it. But essentially the brain doesn't really change, except when it's under the influence. Now, the addicted brain response is different. This is what we see sort of graphically in the person with addiction. They use, why do they use again? Oh yeah, that's right, they like it. Okay, so they get pleasure out of it. But as time goes on, the abuser, the misuser of drugs, this could happen to them, where they end up below normal. This below normal is a reflection of alterations in the brain. What alterations? Well, the slide with Marty Feldman on it from Young Frankenstein is what I'm talking about. What you see is the brain is transforming. It's not just the effect of when the drug goes in, but it has to do with partly having the right genetics, because we know addiction has some genetic links to it. It takes the right exposure to a drug. And if you happen to have that wrong combination, what happens is that brain chemistry is no longer coming back to normal, it's being altered. The brain is plastic in how we think about it, as at least I do. Plastic in that it's moldable, it changes, it makes new connections, it rewires itself. It doesn't make new brain cells, but it rewires itself in various different ways. And that the good part about that, that's responsible for learning and maybe creativeness in us and our memories. That's good stuff. But the bad stuff is if you do things that are toxic to the brain, it potentially could mold that way as well. And these are some of the alterations that begin to occur. Now, so you end up being below normal. Now, what would any reasonable person do with an intact prefrontal cortex do at this point? Stop. But somebody who likes the drug, why? They like it, dopamine effect. They might use again, but see, there's one other problem that happens in a lot of people with addiction. They begin to alter their chemistry enough that this crazy phenomena occurs. They develop cravings for more. See, that doesn't really make sense. This goes beyond the want for, I like to feel better. This is the need to feel better. I want it. I have that mouth-watering desire for it. We think that this is new chemistry being made. This is new proteins, perhaps, in the brain being formed. And so what happens in people is they continue to use and use and use. And they end up at this bottom part here. And I can tell you that feels pretty miserable. This is not withdrawal symptoms. This is not the simple nausea, vomiting, and diarrhea. How you think about this stage of addiction is that dopamine is the feel-good chemical in the brain. It's why people like using, drugs. They get that little bump of dopamine. And that little bump of dopamine is a natural thing. We get it when we eat food, have sex, Think positive thoughts. Imagine if it got set down here, which is functionally what's happening in somebody with addiction. Their dopamine level is getting set down there. If dopamine helps you feel good, this missetting of dopamine makes you feel terrible. When I've talked to many people at addiction problems, I say to them, do you ever just want to feel normal again? The majority of them go, yes. But they were stuck at this point because even when they used, they couldn't feel normal, but if they didn't use, they even felt worse. So this became a powerful driving force to use more. Whereas somebody once used to feel good, they're now using more out of desperation just not to feel so bad. This is the natural progression due to changes in the wiring of the brain. Changes in the chemistry of the brain. I made parts of this slide 17 years ago. I've added some things to it. It took me 3 weeks to make this slide. Thank you. But what it shows is the connection between one nerve cell to another nerve cell. Repeated drug use is transforming the brain. Doesn't do it in everybody, but the longer somebody's exposed, the more likely it's going to happen. This transformation is lots of things are occurring. When somebody is drinking or drugging, the brain is remembering the sights, the sounds, the smells, the ambiance, the feelings, the people they were with, the music that was playing. See, there's an unconscious part of the brain that's estimated to operate tens of thousands of times quicker than our conscious brain does. It's sort of like that commercial that I said, this is your brain, and some of you automatically thought, boom, fried egg, fried egg. Okay. Why? Because it got associated. Like old Pavlov's dogs, Pavlov studied conditioned responses. If you have a dog and you show them your food, they might start salivating. Well, when Pavlov did that, he showed the food and rang a bell. And he kept doing that to the dog. And after a while, all he had to do was ring the bell and the dog would salivate. This is part of the transformation that's occurring in the brain. Part of the other transformation is that the genes are actually altered. Not our DNA, but genetic expression has changed. Some genes are turned on, some are turned off. And that alters proteins. Those proteins change memories. Some of those proteins are also the ones responsible for the development of craving for more drugs. The brain has become hijacked. This area of the brain, the prefrontal cortex, was designed to be our high human brain, I think. It's our wise brain. It's the restraining brain. That's a part of the brain that when somebody's drug-free, you can operate with. This is a part of the brain that as young people, we need to help them with this part of the brain in educating them, fortifying some of the circuits that might protect them. This is the part of the brain that probably once said, I'm not going to go smoke marijuana or drink alcohol with my buddies because my mom says it's not a good idea. This is also the part of the brain, though, as time goes on and somebody starts using a drug, that this part of the brain might get what we call hijacked. It might begin to try to explain those alterations on that one slide that are occurring. This is a part of the brain that might be going, I know I'm drinking a lot, and I got that DUI last week, but, I was kind of in the wrong place at the wrong time. I didn't realize they were there, and I didn't live that far from home. I'm pretty sure I could make it, and, my wife's a son of a gun, and she really drives me crazy, and my boss is a jerk, so, that's kind of why I drink. This is the part of the brain that gets hijacked. This is a part of the brain that's protecting us in a way. It's trying to explain things, maybe even to ourselves. It's a part of the brain that lies. It's a part of the brain that conjures up mistruths. If we were to poll most people admitted to Caron and we ask them initially, well, or at the time of an intervention, say, how much do you drink? They said, a couple. They know it's a darn right lie, right? They know they've been drinking a 6-pack, 12-pack, whatever. But they tell you a couple. Why? Because they don't want you to think poorly of them. They don't want you to think that they might be an alcoholic. So that's that prefrontal cortex distorting things. And it's often trying to explain why this part of the brain is out of control. So what we know about the addiction nervous and neural networks is that it's not only the pleasure of the brain that's changed, it's this area of the brain's been changed as well. Now, as family members, you're up against this part of the brain. Anybody try reasoning with them? See, their brain has already reasoned it out. And you're up against that. You're up against a fortified brain of a human being, far more powerful than any Apple computer ever created, conjuring up reasons why they're okay. And you're up against this. Anybody tried this technique to get through? Talk louder. Okay. How'd that work? Okay. And the brain changes persist. When somebody stops, it doesn't go away right away. There's this phenomenon called post-acute withdrawal. Detox doesn't help anybody get better if you don't do any treatment. You can detox a person 100 times, and there's been studies like that, and they didn't get better because they need some kind of treatment. The changes persist. Here's somebody who stopped using cocaine 10 days ago, drug addict. Changes persist. 3 months later, it's not normal. Now, this person might feel pretty good. This person might feel really good. And on the surface looks good, but it's a lot like having a broken bone. Have you ever broken a bone? Anybody? You know, if you break a bone and you got a broken bone and it hurts like the devil, you go to the doctor and go, I don't care. You put that cast on. I don't care if you keep it on 2 years. I'm fine. Just put it on, man. This hurts. Right? 10 days later, you go back to the doc. You know, it itches. You take this off. And he'll go, no. Why? Because it's fragile. The brain is the same way. These changes that have occurred in the brain don't go away right away. Are we born this way? Yes, and maybe no. Genetics plays a significant role. You have to have the right genes and the right exposure. And there's no single gene that sets somebody up for this. We know that there are different forms of addiction. We know there's, for example, a form of alcoholism that hits every male member of a family and often manifests itself when these people are teenagers. And then there's some forms of alcoholism that don't manifest till much later in life. So there's variations. If we have the adolescent brain, it's forming. The adolescent brain is a remarkable entity that's rewiring itself. It's learning, experimenting, it's pushing boundaries. It's testing the water. Unfortunately, some of those pathways that we might say reflect some level of wisdom or life experience that says, oh, this isn't a good idea, are not yet formed. Therefore, this is a time where lots of experimentation will occur and not a lot of saying no will occur. Study looking at alcohol alone, early exposure to alcohol resulted in increased likelihood of somebody becoming addicted over and above their genetic risk. So early exposure, it's one reason the government argues against lowering the drinking age below 21. lower it below 21, there's a 4-time higher chance of people becoming an alcoholic. Studies haven't been done on drugs because it's hard to find pure drug users. I'm using just this particular drug. But it's speculated that that indeed is a risky issue. So prevention, we don't wait till they become addicted. That'd be like taking care of diabetics only when they needed to be hospitalized because they were dehydrated and in a coma. And we don't treat you until you get that sick. And it affects all areas of a person's life. I put relationships at the top because relationships are always impacted. Job is the last thing to go in an adult. And social life in an adolescent is one of the last things to go. But relationships in their home life are damaged. I used to ask my patients, what do you want me to tell your family? They go, tell them I love them. And I go, I can do that, but let me ask you this. In the last year, what evidence have you given that that indeed was true? Have you been there for them? Have you been present? Have you been consistent? Did you provide security? Were you trustworthy? Were you honest? And most would say, I fell short on that. See, addiction is almost like having an affair with a drug. Now, when somebody's addicted, sometimes they come up with a plan. I've heard many plans that they'll tell me, Doc, this is a really nice treatment center. I really like it. You're a nice guy, et cetera, et cetera. I've been here 5 days. I'm ready to go, and here's my plan. I think I'm going to work on some new relationships. I think, some counseling with my parents will really be good. I think, I'll take up some, tennis. I used to love playing tennis. I get a loan to consolidate all my other loans. I think I'll go to church regularly. Maybe I'll get a new job or I'll do something else after school. And maybe Prozac will be good for me. And I think I'll join the health club and exercise every day. It's a good plan. There's some therapists given that plan. But here's the lie. If they're addicted, the lie in this is, once all of those things are better in my life, I will stop using drugs. Why'd they start in the first place? They liked it. Did that go away? No. And at this point, their brain has changed a lot. Family members are affected. Some of you might have experienced this, or when you finally seem to get through, and I'll ask my families, I go, any of you felt relieved when your patient finally came into treatment? And they'll go, yeah, all raising their hand, I'm so glad they're there, man, this feels really good. And I go, I want you to think about them coming home soon. Whoa. You see, one of the things that's happening to the family members is their limbic system is also being altered. The relationship has changed. You have a relationship often with then a sick person, not a bad person, a sick person. And that plays a significant role in your life. Where once you might have looked forward to them, I can't wait to that phone call from them. Now you go, oh my gosh, what's happened? Or they come home and you've become the instant historian. Where have you been? How long have you been there? How long did it take you to drive here? Who were you with? Maybe you're trying to smell their breath, look at their pupil size, look for signs. See, you're changed. Family members get sick. They may pick maladaptive ways to deal with this that are not so healthy. They get distressed. They don't live as long. People who live with people who are addicted don't live as long and use more healthcare benefits. Medications aren't enough to fix this. We have some medications, for example, that help detox people. We have a couple medicines that might even help cravings. We have a couple medicines that, work for psychiatric problems. But here's what we don't have medications for. We don't have medications that fix those things on that slide of young Frankenstein. That's beyond our technology. The changes that have occurred in the brain are new wires, genes turned on or turned off, proteins formed, pathways lit up. We don't have a drug that fixes that. Part of the solution is sometimes looking at what we'll say is in a realm that's different. 12-step recovery might be a little foreign to some of you, but it involves a tremendous amount of psychosocial support. It involves community support. That's one of the strengths of AA. It involves peer groups that help, and it involves time. Just want to get my mileage out of my slide. So what happens? Well, what we try to do, because there's no magic medicine, we try to repattern the brain. Now, the really cool thing about our brain is as much as we can mess it up, we can begin to repattern it. For example, if every time somebody had a craving, they used a drug, that pathway gets a little bit more fortified. If every time I'm sad, I use a drug. If every time you look at me that way, I use a drug. If every time I hear that music, I use that drug. That pathway gets really very strong and resilient. So recovery has a lot to do with breaking those cycles, breaking those patterns. Some people need to go into a treatment box, in order to achieve that. Some don't. Because now what we try to do is if you have a craving, I want you to do some relaxation things. If you have a craving, I want you to talk to your sponsor. If you have a craving, I want you to work on your step. If you have a craving, I want you to try praying. If you have a craving, I want you to try, these breathing exercises. And what happens is you begin to then change the pathways in the brain, begin to break that cycle. So the good thing is treatment works. There's lots of studies proving that. But one of the things that we know about treatment is that it only does a piece of it. That where they go after treatment is going to be so important, whether it's outpatient, whether it's inpatient, no matter what type of treatment, they're coming back to the community or some community. They're coming back to a place that could trigger their brain, because remember, their brain's remembered and it's associated sights, sounds, smells with their drug use. It's coming back to a place that might be full of various stressors that could be great excuses to go use again. Coming back to a community that hopefully welcomes them with open arms. So I just leave you with the fact that one of the strengths of AA in treating people with addiction was its several understandings. AA really believes that alcoholism is a disease. If we translate that to drugs are a disease too. It's fundamental to understand this as a biological phenomena that has captured complex and intricate areas of the brain that influence day-to-day desires, memories, and feelings. And that in order to get better, somebody has to get abstinent first. Very hard to get people better if they're still using a drug. They have to become abstinent. If they're not abstinent, the brain pathways keep changing the other way. The good news is treatment works. Treatment can be very successful, but it's going to be most successful when communities are supportive of the returning, recovering, addicted person. Thank you very much.